And we are back on the WHHI-TV Daily News. With me now is Christina Brzezinski. She is the Chief Nursing Officer for Novant Health. And, earlier in the program, we talked to the Beaufort mayor to see how they did. A little bit later, we're going to talk to the Bluffton Fire Department to see how Bluffton did. But we really also obviously want to know, Christina, how the hospital system did. How did you prepare for this? I mean, this was quite the event. Talk to us a little bit about it.
Thank you. Yes, it was quite the event. It's exciting to be able to tell the story. So we really started on Friday. So leadership was notified by our emergency management team that there was a storm coming. So we did set up our incident command center. So that just makes sure that we're prepared and we're thinking about things and just how it was going to impact our services and obviously our team members, making sure that we're able to keep them safe. So set up incident command, and then Tuesday, really the planning had to go into motion, right? And so we did things like talking with our partners, we communicate with EMS, obviously working very closely with them, talking to our providers about what their needs are. And then reaching out to our team members, what do they need? So some people decided to drive in and sleep in the hospital. So that required us to prepare areas for them to sleep because the hospital was pretty full. We had a lot of inpatients in there. And so we needed to make sure. And so that's, housekeepers and all hands on deck, making sure that we are ready and we're prepared. We also made the decision to have somebody from our facilities department stay in-house for 24 hours a day, just to be able to take care of the building and the grounds. And then the other thing that we did with operations is we made the decision for Wednesday morning to take all of our elective procedures and delay their start times to 10 a.m. And we really did that because we wanted our team members and our patients driving in the daylight as opposed to in the dark. And so that was probably the first decision that really impacted our operations. And then from there, obviously, we all woke up on Wednesday morning to a lot of snow and a lot of ice. And we did have people, they were struggling to get to work, and we needed them there.
Right.
So we actually had some administrators with trucks driving and picking up our staff. So we were making sure that we were able to take care of all of our inpatients. And so that really was the real big focus, keeping our team members safe. So if they needed a ride, if they needed accommodations. So on the leadership side, it's everyone reaching out to their people that were on their schedules to say, where are you? Are you going to be able to get to work? And really confirm that they were going to be able to do that.
Right. Wow. I mean, that's a lot of moving parts. And, you didn't have the luxury of just saying, oh, it's a snow day. You had to have all those things in place. So it sounds like you had a good plan and obviously were able to execute it. Talk to us a little bit about going through the storm. Did you have people coming into the emergency room? Did you have, those any kind of incidents like that? Or was it kind of business as usual in terms of, wanting to do the procedures that you had on the books, but not seeing too much come in from the storm itself?
Right. So, really Wednesday was the biggest impact. We had delayed our elective surgeries, but then we realized we had to make a plan for Thursday because with the temperatures as cool as they were, the snow was not going to go away. Obviously, the Department of Transportation was struggling to get, with the snow removal because, we're in South Carolina, we're not supposed to have snow.
Right.
And so that's when we really had to look at it and make a difficult decision to not do any of our elective procedures on Thursday. We needed to make sure that we had the people and the resources to take care of our inpatients. We wanted to be able to provide emergency services because we did not know if we were going to see a lot of people in our emergency department. So we did that. It also helped keep additional people off the road so the Department of Transportation could do their jobs. It's much harder when there's a lot of people on the road. So we did no elective procedures. We did obviously do surgeries, but those were for our inpatients. Our emergency departments were not real busy. On Thursday, I think people really were focused on staying in their homes and things like that. But we expect very busy emergency rooms today as people are thawing out. There's more people on the road. So it's not over for us. We're expecting a lot of business in our emergency department. So we're really making plans to staff up. And then again, very busy today as we've pushed a lot of those surgeries from yesterday. We would delay them to today because people need the surgeries. But again, electives, we really wanted to focus on taking care of our inpatients and taking care of our emergency department patients. So just the teamwork was remarkable. It really was all hands on deck. We had, food service workers who couldn't get here. We had our EBS departments who often bus in, and the Palmetto Breeze was not running. And so we were all passing out meal trays. We were gathering garbage. Again, people staying the night here just to make sure that they were here for their shift and they could make sure that they took care of the patients that we had in our hospital.
Well, Christina, thank you for everything that you did to prepare and everything you did during. You guys really did heroes work, so we appreciate that you had all that planning and that you were able to keep everything going, and we appreciate what you do in the community. Thank you so much.
Thank you.
And we'll be back with more, so don't go away.